welcome all of you. My name is Carla Rowe, and I happen to be a co-chair along with Jane Leininger of the Take Part group that came together a short while ago, about a year ago. And tonight I am going to be kind of giving you a little bit of an overview of Take Part and what we are. Take Part stands for, the PART is Portland Anti-Racism Team. We put on a monthly event. The mission of Take Part is to confront racism and to engage in dismantling the systems that continue ingrained racial inequality. We try to do this through different kinds of events, education, outreach, and things that foster engagement in building an inclusive community where all people are treated with dignity and respect. We strive to be receptive and informed by the diverse perspectives of our community. We work together to ensure equitable access to Portland's programs and services and equitable outcomes across diverse community populations. We honor the oneness of the human family without partiality or bias. We work within the current reality of our community, actively supporting new and innovative approaches to eliminating racism. And our goal is to promote a culture of ongoing learning and the independent investigation of truth, so we all educate ourselves on what is happening and how can we actively engage in a positive way to make significant change. One of the things we learned early on and we formed this group is that we're going to be talking about sensitive issues a lot of the time. So we came up with some communication agreements that we try to subscribe to and share with each other. The first one is that we try to listen well, listening from the inside out or from the bottom up, so that you're trying to understand different perspectives. So listening is a key issue for us. We know there could be tension and we're not trying to reduce that, but we do not want to indulge in drama. We really want to have the ability to know that there's a situation and then work through it. One of my favorites is the acronym WAIT, and it says, why am I talking? And I think many times it's a good question for all of us to ask ourselves is, maybe I need to listen, maybe I don't need to talk right now, maybe something's been said and I don't need to repeat it. We really try hard to work on the principles of consultation and collaboration, and we're not competing for time on this event. We're trying to really understand where we all are. Make space, take space just simply means some people are very quiet and they don't speak up. So it's okay to take the space you need. And if you're somebody like me who tends to be more verbal, I need to listen quietly and make space for other people to talk. We take away the lessons that we learn from our time together, but we leave the details behind. So confidentiality simply means we don't name people and who said what and that kind of thing, but really look at the content and the lessons we're learning. And that leads to number 7, which is be open to learning. We're here tonight because we all hope to learn something from each other. We also try to assume best intent. Sometimes we need to attend to the fact that what we say has impact, whether it's intended or not. But if somebody misspeaks, we try to assume best intent and then ask questions about what they're thinking. And finally, take care of ourselves and the community, because in the end, we're really striving to build a strong community moving forward. So having said all of that, I actually now get the honor of introducing Bahia Overton. She's our speaker for tonight, and she's going to talk to us about the impact of COVID-19 on the Black community. Bahia holds a bachelor's degree in psychology and a master's degree in social work. She's completing her PhD in social work research, and she's focusing on the experiences of African-American female adolescents in foster care. Ms. Overton is currently serving as the director of the Black Parent Initiative. She's also the executive consultant for Joy DeGruy Publications, and she assists Dr. DeGruy in researching historical trauma and developing new models and methods for culturally responsive service delivery. She has assisted with training and development for government agencies in creating and sustaining equitable policies and practices. Overall, she has over 14 years of practical experience as a professional in the field of social work. She served as a child and family therapist, curriculum developer, culturally specific treatment specialist in several different states, and lots of various community-based organizations and government entities. She serves on a lot of different boards and councils, like the Oregon Student Voice, Organic Oneness, Oregon Educator Equity Advisory Group, and she is an active member of the Baha'i Faith, which espouses the oneness of the human family. There's a lot more I could tell you about Bahia. She's an amazing woman, and I look forward to her talk. So I'm just simply going to turn it over to Bahia.
Well, hello. My lovely daughter is bringing me coffee. Isn't that sweet? Okay. Thank you. Thank you. Well, first of all, I have to say thank you so much for coming tonight. This is my absolute most favorite thing to do, is to connect with people, and it's a little one-sided, but I will take it. I think that the best thing that we can do is serve one another well, I think, as human beings. And so anything that I can do to help people understand ways to do that better or things to consider, I'm going to take that opportunity. So I really appreciate that you all are here with us today. I'm excited, and at some point I think we will have some kind of interaction towards the end. I'm an extrovert, so it's very weird for me to talk and have like no response. So anyway, I'm hoping that I can see raised eyebrows or surprised looks that will feed me throughout this process. So I'm going to go ahead and share my screen, and we'll get started with the presentation. Again, thank you so much for having me here, and I'm excited about what might come from this. So I'm going to go ahead and share my screen. So I'm very excited to be here with Take-Part. We're going to be talking about COVID and disparity in communities of color. As Carla mentioned, I am the executive director for the Black Parent Initiative. And so primarily our experience has been directly with African-American, African-American multicultural or multiracial families. But we are also serving on a lot of committees for other organizations that serve different communities of color. So I have some insight into how COVID is also impacting those communities. But primarily my expertise, both living in this skin and also in the work that I do, is primarily with African Americans. To that end, I want to say that I have a couple of goals for us. Leaving this presentation, I want us to have a bias toward action, which really means that we all have a part to play. We all have ways that we can influence those who influence policies, those who influence culture, and inclusivity. We have an ability to do that. So I think I want everyone to leave here with a bias towards action. I want us to really explore, think about, and I think they mentioned it in some of the agreements, exploring the path between intention and impact. That's really something that I think that we should explore more, because we all assume positive intent. We all want to see good things happen, but sometimes the impact of what our intentions are, they don't match. So, and then ultimately, you can be the change in your circle, your sphere of influence. Everyone has the ability to be and make change. Okay, moving on. Next. Okay, so now a little bit about who I am, why I do this work, what I hope, and what I know. So this is my family. It's not everybody, but it's a good percentage of my family. And my family definitely has fueled and inspired my work, my commitment to bridging the gap between human beings. You see my mother's Dr. Joy DeGrew, my father's Henry Cross, my Aunt Iris is there, and I know that she is on the line with us today. And my children, these are folks that I work for, and who inspire me and keep me moving. So I like to bring that in so that they come into this space with me when I do this work. My hope is that we will learn enough about one another, that we will be more effective advocates, champions, friends, family members, that will support us moving towards the oneness of humanity. And what I know is that this is an inevitable thing, right? My uncle used to say, there's no them and us, it's just us here on this planet. It's just us. So my goal is that we move towards that reality, but by doing so very intentionally. So just a little bit about that. All right, so we talked about our agreements, which is great. I love agreements, they're important. I only have one request. Throughout this entire time, there's going to be information that most of which is pretty factual, but some of which may cause you to feel some kind of way, right? So in your body, you might feel something, you might feel anxious, you might sweat a little bit. And I'm just encouraging you to be curious about that. Why am I feeling the way that I'm feeling? Just like, why am I talking? Why am I feeling this way? Is it because what she's saying isn't true? Is it because it's in contrast to what I've learned my whole life? Does it make me uncomfortable? Does it make me feel guilty? What are those things? And I think that has to do nothing with what anyone else thinks about you. It has 100% to do with you reflecting on yourself, where you are in your own kind of equity journey, what you can do, and maybe where you need to grow, right? So if you can just be curious throughout this whole process, I think, and I'll give you a couple of opportunities to pause and reflect and be curious. But that is one thing that I ask that everyone just agrees to be curious. So moving into what is disparity in general, okay? So disparity refers to a higher burden of illness or injury, disability, or mortality experienced by one group relative to another. And basically what that means is that, and generally what that means is white individuals versus non-white individuals, or people of color, and their health outcomes, illness, injury, disability, as compared to the majority population. So we think about how you, in healthcare, we think about the way that you get covered for insurance, how you can access healthcare providers, and also how those healthcare providers treat you once you get there. What is the quality of care that you receive? All of those things impact how the health and well-being of people of color disproportionately to white dominant culture. So you want to kind of be curious about why would that be the case, right? And I will tell you, the reason for that is racism, because racism, really the root cause of all disparity in this country is generally racism. And you're like, how can that be? There's so many other factors. I'm going to explain this to you. So if you're feeling a little pushback in yourself, be curious about why. But I'm going to move forward so you can kind of understand my way I'm thinking. Now, one little caveat, I would like to say that I get excited about this work. I geek out on it. So if I start going really fast, just somebody kind of do this, because once I start rolling, it's moving. So just slow me down if it seems like I'm going too fast. All right. So when we start thinking about racism, I want you to understand the definition that I operate with as I do my work. So it's important for you to understand what I'm saying when I say racism, so that when we go to talk about how racism impacts the health and well-being of communities of color, you understand what I mean. So racism refers to, in my working definition, a system of advantage based on race. A system of advantage based on race. This isn't person-to-person interaction. This is systemic and it's ingrained in institutions. What that means is that as prejudiced as I might be, I can be equally as prejudiced as anyone else. I can just say, I'm going to base all of my beliefs around stereotypes, who you are, hate you, don't like you, never speak to you, but I'm not going to impact necessarily your ability to buy a house, to secure a car loan, to go to the school of your choice, to receive proper health care. These are things that I'm not going to be able to operationalize with my prejudice. But racism suggests that you also have the power to impact whole groups of people with your prejudice. That's the difference. So when people say, well, can Black people be racist? No, not really. They can be really hella prejudiced, but they can't be racist, because I don't have the ability to change your whole world. And that is what we are experiencing when we talk about disparity, is that there's systems that are operating to support and uplift and sustain the health and well-being of white individuals. And anyone who folds themselves into those systems is going to be therefore treated differently, have different kind of outcomes. So remember, when I'm talking about racism, I'm always going to be talking about the system of this process to maintain white as supreme and everyone else as beneath. Okay? Important to know moving forward. So to that end, also, this is what I want you to think about and be curious. Why do you think it's important to have shared meaning and common language? Think about this with your family, with your organization, with your clubs that you belong to. If you have an understanding of racism that is a system of advantage based on race, but everyone who's around you believes that it just means anyone can be prejudiced, it's going to be really difficult for you to get your point across when you're talking about making changes that impact the greater community. So shared meaning and common language is very important. Think about that in your family, right? If you talk about white supremacy, do people think that you're talking about hooded individuals who are, coming to the homes in the night, or is this a historical reference? When we talk about white supremacy, we talk about white as supreme, meaning white as normal, white as what is valued, what is best, what is right, what is professional. That's what, when we start talking about white supremacy and the fact that it is systemic, that's what we're talking about when I'm talking about. But if you're trying to share with your friends, family, coworkers, the idea of white supremacy, and they don't have that shared meaning or common language, you're not going to get very far. So that's why I wanted you to just kind of consider that for a second. So here's a few things that you might want to think about in terms of developing a definition and making sure that people around you understand those definitions. Now, EDI stands for equity, diversity, and inclusion. These are common definitions that come up in people's equity plans. I see it all the time, their equity lenses. And if you don't have a shared understanding throughout your organization, community, even religious community, this can be a source of disunity because we're not operating with the same understanding. Moving on. All right. So now, when we start thinking about the impact of racism, racism is a pre-existing condition. What does that mean? Right? We've heard that COVID is disproportionately impacting African Americans because they have so many pre-existing conditions. Pre-existing conditions for, diabetes or hypertension or, asthma, all of these things. But what is the root of those conditions, right? So when you think about medicine and medical research, there is always some explicit or implicit suggestion that Black people are to blame for their health outcomes, right? Rather than to look at how you should be providing resources and tools that eradicate the inequities that are as a result of racism. So therefore, living with racist experiences on a regular basis depletes you as a human being and makes you more susceptible to health issues. To explain that a little bit better, if you have Black and brown individuals who come to this country from the Caribbean, for instance, or who come to this country from, or who are like Black Hispanics, any folks who come here initially, even if they have not had the same access to healthcare, prenatal care, healthy foods, organic foods, generally their health outcomes are better than African Americans when they get to this country. But within 1 year of being in this country, their health outcomes match ours. Why? That seems interesting. Why would it get worse when they got to this country that has so much more for them to offer them in terms of food and health care? Well, in their communities where they came from, they may have been poor, they may have not had adequate health care, but they also had a lot of people around them that looked like them. So what they didn't experience on a day-to-day was racism. So the impact of experiencing racism once they came to this country, over a year's period of time experiencing that, their health outcomes match ours. And to note, among second generation males from the Caribbean have the highest suicide rate amongst Black communities throughout the United States. So that goes to show you how impactful racism can be on your health and well-being. Just walking out around every day. So I'm going to give you a little story here, just because if you know my family, you know we're all storytellers. But I tell stories mostly because I want people to be able to understand this in real life, right? So when I wake up in the morning, I'm not waking up as Black Bahia, right? Mostly I'm waking up as mom, okay? Waking up as mom, and I'm doing my mom thing. I'm not thinking Black Bahia, Black mom, just living my life. And then I walk out my door and I wave to my neighbors, and immediately what comes to my mind is Black. Because, not because anyone's being mean to me or disrespectful, but because no one else is, right? I look around and I'm like, oh, not Black, right? Black. And that's not a bad thing. It's just something I notice. So I've talked to my coworkers sometimes, and I'm like, I just want you to imagine waking up. And I was talking to my friend Jen. Okay, Jen, you wake up and you get out of your bed, and you're just mom doing your thing, and you open the door, and your whole community is Black. So you're like, hey Jamal, hey Keisha, hey Bahia, right? You're saying that to everyone, and everyone's smiling at you. Hey, hey, hey. Immediately, you're gonna remember I'm white Jen. No one's mistreating you, but you're gonna just remember that, like, I'm white Jen. Okay, it's all good. You get in the car, you turn on your radio, and everybody on the radio is Black, and they're cracking Black jokes that you're like, I don't really get it. their whole tone is different. You're just the whole way they're communicating, talking over one another. You just like, okay, a lot of Blackness coming in, but it's good. It's nice, it's fine. And then you pull up to Starbucks, and your barista is Black, and she's like very direct, and she's like, what do you need? Okay. Come on, let's go. And you're like, whoa, it's just a little bit different than I'm used to. All right, but she's cool. You go to work, and everybody at work is like, hey, how are you doing? And they're not using parliamentary procedure. They're coming to consensus a different kind of way. And you're having to kind of jump in with your ideas. And everyone is talking about their families as you walk in the door. And you feel like, is this right? Is this professional? Or you're having all these feelings, but you're in this dominant Black environment. So you just adapt. And then you go home, and then you get a call from your child's school that wants you to come to the all Black PTA meeting. And you're like, no, thank you. No, thank you. They're great people. I'm just tired. I'm just tired of all of that. It's a lot. I said, that would happen to you after one day. But this is what I live on a day-to-day basis. I have to figure out how to fit into spaces that are not created for me. And I have to find a way to be in those spaces and to be comfortable in those spaces and to still do my job, even though my coworkers don't speak to me, even though people don't pay attention to me or don't value my input sometimes. So having that experience on a day-to-day basis, I'm sure you felt exhausted just with me giving you that scenario. But if you think about that, that is the life that I live. That's the life that my children live, especially in Oregon. It's just what the experience is. So just to think about that, how that might be for you if everywhere you went, you had to adapt to a different culture. Okay, so in other words, racism has a biological impact on and in the bodies of Black and brown people. The chronic stress of everyday racism makes us sicker. Plain and simply put, African Americans are more likely to experience racial disparities, and this is why we see such high rates of hypertension, asthma, diabetes. COVID-19 related infections, then, you also see those at a higher rate, and death, ultimately. All right? Which brings me to my cousin Maya. So I want to tell you a quick story about my cousin Maya. My cousin Maya lived in Georgia and is 46 years old, healthy. And she was diagnosed with COVID, and they put her on a ventilator. And a little while after she was on that ventilator, they contacted her parents, who both lived out of state, and told them that, we can't do anything else for Maya. We've done all that we can do for her. And they were suggesting that they take her off the ventilator. So, the family, they came together, they called my mom, they called my aunt, they sat down, trying to talk to different family members about what to do. And my family was kind of like, she's 46 years old, and if her organs aren't failing, like, why would you take her off the ventilator? That doesn't make any sense. So we really couldn't make any headway. We couldn't figure out what was going on exactly with her, even though, we're educated folks and we self-advocate and we do all that stuff that, could get us in the door to find out what's happening with Maya. But it wasn't until we contacted our dear friend Arta, who's Persian, who called the hospital and demanded to talk to the pharmacist, and kind of moved his kind of male and non-Black privilege, wielded his way in, and found out that not only had the pharmacist expressed that, not only had they not given her the medication that they said they gave her, they didn't even have it at the time that they told the family that they had the medication. So they had her on a palliative plan. This is a plan to keep her comfortable basically until she dies. And they moved her immediately after giving her the medication she was supposed to get. They moved her to a rehabilitative plan. And now she's actually talking. Okay. So we went from there's nothing else we can do for her to she's functioning and on the mend and, no longer on the ventilator. Why did that happen? Think about that. Why did it take a non-Black physician to advocate for Maya for her to actually live? Right? So this is a moment for you to reflect. How might racism have impacted that situation? Right? If Maya was white, would that outcome have been the same? Would they have called her parents and said, there's nothing left that we can do for Jen? Right? Would that have happened? Just be curious about that. Because when you're curious about it, what I think should happen inside of you is feel some unrest about that. And that unrest is going to be the thing that actually fuels you to make changes in your sphere of influence. So pay attention to that. When you start thinking about explicit and implicit bias, it was blatantly a lie. So that's explicit, right? But implicitly that we were not this feeling of lack of accountability to us. And maybe a fear of accountability because Arta was a physician, I'm not sure. And just think about that. If we had not had him advocating for us, what might have happened to Maya? That is the gist of discussing about how racism impacts health outcomes for Black and brown people. So moving into what we talked about earlier, intent versus impact. So I am sure that the doctors who took their Hippocratic oath and who are serving in these hospitals, that their conscious intention is to serve people well, to save lives, to make those who are ill well, right? And so that's their intention. But whatever biases were operating, the impact of their service and care or lack of care could have had really very deadly outcomes for my cousin. And I don't know how many other people it has actually resulted in death for them. So this not only goes along with, we're talking about health disparity, this also has to do with your day-to-day basis. How many people have told me, I'm sorry that you took it that way because my intention was, I really don't care about intention. I really don't. It doesn't matter. If the impact is harsh, then that doesn't matter. If I run you down by accident, I've still run you down. you still have your legs are broken. Okay, we have to attend to your legs being broken, not the fact that I didn't mean to. And so this is extremely important when we start talking about creating social justice efforts that are unified, right? To think about your impact versus your intent, right? And so if you see the definitions here, intention or purpose, resolved or determined to do something, showing earnest and eager attention. We have the best of intentions, but the effect or influence of the person, thing, or action or another can change the scope of an entire community, right? It can change their ability to thrive. So it's something we should consider. So we're going to look a little bit at Oregon. Okay, so this is what's happening in Oregon when it comes to communities of color and the disproportionate impact, right? So there's a couple of points. In Oregon, the rate of infection is nearly 4 times greater among Pacific Islander Oregonians. The rate of infection is 3 times greater among Hispanic Oregonians compared to white Oregonians. And Oregonians that identify as Black or American, Indian, Alaska Native are impacted at nearly double the rate of white Oregonians. So you can see all of this. So it's not just about who's getting COVID, it's really about who is disproportionately being impacted by this disease. So it's important for you to pay attention to that. You can just see the rates. Okay. So when we start looking at our community, it's kind of interesting for us to pay attention to this. And I think about this all the time. Children are our future for sure. And what we feed them, how we instruct them, what we model for them is going to tell us about what we're going to look like in the future. So when we start thinking about this, when we look at Oregon, we have much more diversity among our children than we do among the adults, right? And because of that, we're going to need to serve them better than we've been serving the rest of the community, because the outcome, the disparity is just going to deepen as they get older. So when you think about that, think about the kind of impact you may have on the children in your sphere of influence. Your kids, your grandkids, your neighbors. How are you interacting with them in a way that affirms them, sustains them, or are you constantly scolding them, redirecting them, monitoring them, managing them? I think those are things that we need to consider when we start thinking about building trust and strong relationships across communities of color. And they're disproportionately going to be impacted then, those communities, if their parents are suffering from COVID infection. So it's something for us to also consider. This is kind of out of order, but we'll talk about this. So everyone has seen this. I just wish we could get a whole new slide. This thing is so common. I would see it every training I go to. I see some variation of this, right? So we start talking about addressing disparity. We're having some conversations across the state around what does it mean to have equitable outcomes, since we focus so much on inequity. So in this picture, I think I'm pretty sure everyone has seen this picture. They talk about not giving everybody the same thing, giving everybody what they need is what it's suggesting. However, I'm still kind of like, first they got the fence and then now they don't have the fence, but they're still not in the game. They're still in the crowd. Like, I don't understand it. So the last little block here is for you to think about actually beyond that. What does it really mean to be inclusive, right? When I explain equity versus equality to people, I often talk about it in terms of restrooms at the movie theater. Okay, this is how you can really understand equality versus equity. So equality means that you have you have a male bathroom generally and a female bathroom. I don't know how many movie theaters have gender neutral bathrooms, but right now you pretty much have a male bathroom and a female bathroom. And generally it takes men about 1.5 minutes to go to the restroom, and takes women about 3 minutes just to go to the restroom and come out. So there's always a crazy line in the women's restroom. It's ridiculous, okay? It's ridiculous. And the men's bathroom has no line ever. So it's equal because you each have one, I guess, in that sense. But what would be equitable would be if we had 2 bathrooms for women and 1 bathroom for men, so that they didn't have to be in line. There's a disparity right there. So that's the way I kind of try to explain when you give people what they need in terms of what is equitable versus equality. But I always want people to think beyond this photo to the next thing, because it drives me crazy. I see it all the time. So I'm just waiting to see something new come about. But something to consider. So we're talking, in the work that we do, we work with early childhood and early childhood education, and we're looking at the kind of investment that we have from our state in supporting communities of color. So you see this tiny little sliver right here, this tiny little sliver. The red little sliver is really the amount of funding that is supporting African multicultural communities. So of all the money that's allocated, that's about how much they're really investing. And so when you start thinking about how do we start to mitigate these disparities, we're not doing that great of a job because we're not investing our dollars in closing those disparities. We just think that they will close without, and so we've been doing a lot of advocacy work to make sure that we get more investment so that we can get greater outcomes. Just something for you to consider. Look at that tiny little sliver. I don't know what they think we can do with that little sliver, but I guess we work with what we can work with. So we start to think about the impacts that we're seeing from COVID-19. Basically, it's just another symptom of a larger problem, right? These are historic policies that have created the conditions for these disproportionate impacts. And when we talk about investing in our communities, like the Equity Fund, these things are intended to support organizations so that they can self-determine what families need. So when you start thinking about how you can have impact and how you can influence the influencers, our goal was to influence Oregon policymakers, right, to try to value equitable outcomes in these communities by investing more in those communities so they can decide for themselves what they need. So that's the sphere of influence that I'm trying to have. you all might be in different places where you can push on policies or practices that will make some sort of difference. But really what you have to always consider throughout this entire time is that you're working against a system that is designed to hold certain people up and designed to keep certain people down. Not intentionally necessarily. Well, in some cases intentionally, but not always intentionally. But when you're not being curious about why, not just why you're talking, why am I talking? Why are you voting this way? Why are you adopting these policies? Why have you put in place certain types of practices and protocols? It's important to be curious about how those things are impacting larger communities, regardless of what your conscious intent is. Okay? We just talked about that. You don't have to go back there, but just be curious about that. When you put more money into a group or a community, why are you doing that? How do you, are you deciding how that's going to be spent, or are you empowering the communities to spend the money in a way that will serve the community better? Or are you divesting your dollars and value caring from those communities, which is resulting in disparity? Something to be curious about. So moving into implicit bias. Now, this is very interesting because I think that people have heard a lot about implicit bias or unconscious bias. But, you know, talking about disproportionality in terms of COVID, we have to go back to the root cause again, which is the system of advantage based on race. And how does that system continue to operate when everyone is so well-meaning and has such positive intent? And that has to do with what is unconsciously operating underneath your bias that you have, that we all have. But how does that bias then impact others? So implicit bias is the implicit social cognition or implicit bias. Oh, I have some typos in here. Sorry, guys. To the attitudes or stereotypes that affect our understanding, actions, and decisions in an unconscious manner. This is what people have to understand. This goes back to intention and impact. Doesn't really matter what you meant to do. It matters how that impacted, what the impact was. Okay? Personal story. Sorry, you have me. This is what I do, tell stories. So, another story. I am going to the grocery store at about 7 o'clock p.m. one night. I'm wearing a suit, which I rarely wear, but I'm wearing a suit that day. So by all, you know, in terms of what people consider professional wear, I was dressed as a professional that day. And I just was like, I had just been putting off going grocery shopping. My children really needed some groceries and some lunch stuff. So I went to the store and I have all these groceries, like it's like 7 o'clock at night, all these groceries. And I get to the front and the lady says, so this will be EBT. Okay, so for those of you who don't know, EBT is the food stamps program, SNAP benefits that people get. And there's no shame in it being having SNAP benefits. There's no shame in being, you know, using food stamps. However, she made that assumption based on my skin color. There's no other reason. Like in terms of why do you think that I can't pay for my groceries? What is your immediate bias? And again, I wasn't trying to be Black. I was just trying to get some groceries. I'm just trying to get some groceries. But the implicit bias told her this woman is brown and getting all these groceries she can't possibly afford. Therefore, she must be on SNAP benefits. That's what the unconscious bias was telling her. And that is why she engaged me that way. Now, again, it's 7 o'clock at night. Am I interested in having a whole training now with this cashier? Not really, okay? But I have to take the time to talk to her manager and say, you need to put in some training because I'm not gonna go, no, because somebody behind me might, you know, be on EBT. I don't want them to feel ashamed. But I am gonna say, maybe you should ask that question and not make those assumptions. And I don't think that she was intending to offend me, but it's really not something that I needed at the end of my day. It's just, the impact of that was much greater than her intent. And so I think it's really important to understand that now I had to take that with me to my house, where I might have been lighter and more patient. And with my children, now I'm a little bit tense, and I have to try to weed that out in order to function in a positive way. So it's important to think about that. And it doesn't matter that Bahia is educated and Bahia speaks pretty proper English. It doesn't matter. When you have implicit bias, there's no protections because it's built on racism. So, all right, now this is the part where we're going to try something. I want you to watch this video.
Think that microaggressions are a problem?
Oh, you're so well spoken.
Oh, just imagine, instead of being a stupid comment, a microaggression is a mosquito bite.
Ugh, it's a compliment.
Mosquito bites and their itch are one of nature's most annoying features. But if you're only bitten every once in a while...
No, where are you really from?
Cleveland?
Sure, it's annoying, but it's not that big a deal. The problem is that some people get bitten by mosquitoes a lot more than other people. I mean, a lot more. Whether it's on a date...
Oh, your English is so good.
Excuse me?
Going grocery shopping.
You know, everything happens for a reason.
I'm just buying apples.
Commuting to work.
So when are you gonna have a baby?
Watching TV.
We have to keep the Redskins name. It's part of our culture and history.
Or just walking down the street with your partner.
I couldn't even tell you were gay.
Mosquitoes seem to pop up everywhere.
Do you know John? Give me shopping advice. I love Cher too.
And getting bit by mosquitoes every goddamn day.
Can I touch your hair?
Multiple times a day.
So pretty. Can I touch
it,
your hair?
please? Can I please?
Is fucking annoying. And makes you want to go ballistic on those mosquitoes. Which seems like a huge overreaction to people who only get bit every once in a while.
It's just a mosquito bite. Who cares? Just another angry black woman.
Of course, beyond just being annoying, some mosquitoes carry truly threatening diseases that can mess up your life for years.
Astrophysics? Maybe you should try less challenging, Major.
Ow, my dreams.
And other mosquitoes carry strains that can even kill you.
He looked like he was up to trouble, okay? I felt threatened.
So next time you think someone's overreacting, just remember, some people experience mosquito bites all the time.
You're all so exotic. Wow.
And by mosquito bites, we mean microaggressions.
Okay. Oh my goodness, that worked kind of. Well, anyway, before I go back to my video, since I'm so happy to be looking at faces right now, I feel like I'm like in a space station or something. It's so odd. I really wanted to get to implicit bias with the mosquitoes. I'm sorry I didn't tell you there was curse words in that video. Sorry. Hope there are no babies paying attention. But what I love about that, and what I use it sometimes in my trainings, is because I want people to understand that microaggressions aren't really micro. We say that because they're not overt, but the impact of microaggressions is it's huge. It's not light. And what happens is, I always tell people, you never know what one you are for the day. You could be like number 11 giving somebody something, and then they go nuts on you, and you're like, what's wrong with that person? But you're like number 11 microaggression of the day, and I just can't, the person just can't take it. And so it's something to be considering when you think about intent versus impact, is that all of those things that were said, pretty much, my favorite was the astrophysics. He's like, oh, my dreams. Because the whole idea that, I'm going to minimize you in a way that doesn't feel like I'm minimizing you to me, but the impact of that on you, just be curious about. This is kind of like, why am I talking and what am I saying and what do I think the impact of that is going to be, is something we should think about. Okay, we're going to go back to my screen share. Hopefully this works properly. Maybe.
Bahia, it's Carla. I'm just going to give you a quick update that we have about 10 minutes left.
Okay, good. We're
before questions. Before questions.
Okay, good. We're almost through this. These are mostly, so the part about implicit bias that I think that part of that I'm excited about take part is that we are trying to find ways to interrupt these things. So if you interrupt racist behaviors, if you interrupt microaggressions, if you interrupt places where there's implicit bias, you are fragrancing your environment with unity, oneness, and justice. And when you do that, then it's kind of like the fumes of that waft into policies, and the fumes of that, wafts into the way teachers interact with their students, and the way counselors work with their clients, and the way doctors work with their patients. So we all have a part to play in that. We all have the ability to disrupt it. But in general, people have a difficult time interrupting them in the moment, especially white people. White people tend to not want to create conflict in those spaces. And so they are usually quiet. What's happening right now in the United States, I think, is super heartening, because people are going, I can't sit here and be nice. Just being nice isn't going to help me make a change. I have to actually show that I'm for justice and I'm for oneness. because you really can't have one without the other. You can't have oneness without justice. You can't have unity without justice. So working for justice in small ways, interrupting the conversation at the dinner table, or a joke that someone tells, or someone kind of minimizing someone else's intelligence, or second guessing someone's motives. There are all so many ways that you can interrupt in a way that's not necessarily all that shame. Just to say, I'm curious. I'm curious what your intention was when you said that, because it feels like the impact is this. I'm curious about why you're feeling the pushback from what I'm saying. Like, what's happening with you? I'm curious about that. Or encouraging them to be curious. Can you please be curious about how this policy that you've created might impact others? So that's one way that we can definitely do our part in this. When we start talking about being asset-based, when we're talking about dealing with disparities, they're rooted in our preconceived notions about what is best, and for larger organizations thinking that they know what is best for our communities. So when we start thinking about being asset-based, we are countering the narrative that everything that happens in our communities is at a deficit. So instead of saying, I've heard a lot of people say, you hear underachieving and underserved, and their achievement gap, and all these things that you constantly are hearing about your community, it can start to make you feel like, wow, this is just our natural station of just being below everything. That's not true. But the language is super important. So I've been working with people, in particular teachers, who love to use the term subgroups. And I always tell them, you can't continue sub to who? If they're a subgroup of people, who's the upper group? Who's the above group? And they're like, well, what are we going to say if we don't say subgroup? And I said, groups of Black students, groups of Native students, not subgroups. No one's sub anything. No one's a subhuman, right? So when we start thinking about being asset-based, we start saying, oh, they're not at-risk youth. These are youth with promise. These are youth that need opportunity. They're not at-risk youth. When we talk about communities of color, we don't say they're low-income families. We say they're families who are from, economically disadvantaged communities. The community has been economically disadvantaged, but they're not low-income people. When we frame things that way, we're constantly putting people at a deficit, and we're not seeing their true value. So when you're talking about being asset-based in not only your language, but asset-based in terms of, I believe that the key to the success of this community is within that community. And so you support and value a diversity in thought and culture and traits, and you see them as not different or wrong, but as correct and in context better for communities than what you might think is best. Just some pieces around just using asset models and working with communities, especially if you're trying to address disparity. Consider these things, right? Instead of thinking about all the things that are not in the community that they don't have, think about all the things that they do have, right? They have unique strengths, passions, interests. They're competent and capable. They have their own personal power. They have a lot to offer other communities. And there are resources for educating others. There's a wellness of resource there. And even if they're not in line with someone else's kind of music, that doesn't mean that you're out of step. It doesn't mean that they're not paying attention. To consider those things. We won't do that. I'm not going to do that. I'm not going to do that. I'll just basically say that it's important when you're trying to figure out how to work with others, especially in deconstructing health disparity. You need to be considerate and you're trying to help a community, that we all arrive at our understandings differently, right? Our axiology, what we value, right? COVID has required us to be separate, but our axiology as African Americans is really member to member. Like, the highest value lies in the relationship between people. So in our strength and our survival has been in coming together, right? And so the fact that our survival now depends on us being apart is axiologically, it feels counterintuitive, right? And then your epistemology, the way that you know something, right? In the Baha'i faith, Black people are called the pupil of the eye, right? It beholds what is before it. And we kind of really can see things in a unique way. We have a unique perspective. And we value kind of that way of knowing. We can feel our way there in a lot of ways. I can feel the environment. I can feel your intentions. I can feel whether or not you're sincere. And then we all vary in the way that we arrive at what's logical to do, right? And how it should be done, which is the process. So I think I'm going to end there, just because I want to make sure that we have time for some questions and answers.
So thank you, Bahia. This is just wonderful. It's so nice to see you. And I do want to say that at this point, what we're going to ask is that people go ahead and type some questions into the chat. There is a question about whether or not, since we're coming to the end of our time together, there are people who don't want to miss the last of the question and answers. So they're asking if we can also make sure we've taped that on our video. And I think we have consent to do that. So we can do that and talk with Bahia about how to best post this. There are several people asking how to find this information and your talk afterwards. We do have a Facebook page called Take Part. There is a brand new YouTube channel for Take Part. And there is a website that we're going to try to put these things on. And it's also, the website is www.takepart, all one word, .pdx. And so we'll try to put that information out for you as well. So I am going to go to the chat room. And between Randy and I, we're going to monitor for some questions and try to read them out to you. There is a question. It said, why did you say that people of color can't be racist at the very beginning? This individual feels that's false. He says he experiences it often. And he described himself earlier in our chat as being, I'm trying to find your information, but it looked like you described yourself as being poor and having access to health care. And, I think we'll just leave it as a simple question, knowing there's not one answer for every single human being. But if there is an opportunity, Bahia, what do you think?
So what I was trying to suggest when I said that, and again, what people have to understand too is that you may have had an incident where someone was able to be oppressive to you, right? You might have had someone really do something that was racist to you, like they actually had the power to give you a stipend or to let you have an appointment, and they may have actually exerted their power with their prejudice against you in that incident, but that's not institutional. That's not the entire system. That's incidental. It happened to you, and it's valid, and that makes sense. But what we found across the United States, but particularly in Oregon, because I got this comment a lot from superintendents when I was working for the Chalkboard Project, who would say, well, why don't we talk about poverty? Why do we start with race with you? Why don't you start with poverty? Because everyone has the opportunity. Poor people have it the worst, regardless of what race you are, right? Well, what we found was if you lift a white kid, for instance, in rural Oregon out of poverty, right? You lift him out of poverty, you educate him, he goes on to go to school, he becomes a functional part of society, he pays taxes and does all those things, he thrives. If you lift a black kid out of poverty, and you give him education and you give him wonderful housing, and he goes on and he goes to Harvard, he ends up having the police called on him in the park while he's bird watching. Okay, so the racism you're not going to get to serving him well by starting with poverty. However, if you start working with black people first, poor black people, if you work with a poor black person who's from an impoverished community who's black, it's going to intersect with everyone else, with poverty, with disability, with health, because if you serve that kid well, that kid who's, having it come at them from all directions, you're going to serve everyone well. So I would say, I don't want to invalidate your experience that you've had experienced people doing racist things to you. That's very possible. I'm not suggesting it's impossible, but systemically, Black people do not have the power or the ability to use that prejudice to change your life of everyone in your environment and everybody who looks like you. That has been the case in communities of color, where whole groups of people have been impacted by policing or the healthcare policy or the educational policies, boundaries, school boundaries, all those things that people create impacts the entire community. And it's built on a sense of one group is supreme and should have options. So that's how I responded to that.
Thank you. Amanda also posted that she says she believes by the definitions we're using of the term racist, that what he was experiencing is prejudice. and that the definition of racism we are using is an institutional prejudice, which supports kind of where you were coming from. I have two other questions here. The next one is, what happens when we add language barriers and policies that don't support mandatory language interpreters in healthcare? Do you know of any groups in Oregon trying to pass policies to help with this?
I know that Latino Network is trying to do that. I know also Africa House that works under IRCO, which is the Immigrant Refugee Community Organization. They also are trying to push policies and legislation that requires you to have interpretive services, because it's already hard to advocate for yourself, but also if there's a language barrier, people not feeling compelled and using children or family members as interpreters is really not appropriate, especially in traumatic experiences. So there are organizations that are pushing for that. You can probably contact them directly to get that information.
There was a comment on here that said Oregon Health Plan requires interpreters for their patients. It came from Felicia. Okay. And Marianne also posted a resource in Washington County that serves Spanish speaking women with access to jobs, healthcare, and housing. And she put that in the chat. If you want to look at that actual name of that and get that right, it's another organization. This is from Christine. Could you please speak more about the social determinants of health?
Yes, I mean, my degrees are not in public health, but I can speak a little bit to what we've experienced. When you look at your determining your health outcomes, largely depends on your access to quality food, your environment, the level of stress or violence in your environment, your access to educational resources, and your access to, I would say, I want to say law enforcement, but your access to protective services that are advocating, that are working on behalf of you, impact your overall health and well-being. So when you start thinking about children, for instance, we work with children who are pre-birth to 6, pretty much. We are looking at, our kind of philosophy is that you're born to learn, ready to learn. And the idea is that, cortisol, the stress hormone, crosses the placenta. So if the mother is super stressed because she's living in housing that's not stable or safe, she doesn't have access to food, as is in the county, like East County right now, we have a lot of people who've moved to East County, and the housing is not adequate. There's not adequate heating and cooling in the summer. And so you have people highly stressed, not having access to food, maybe not having the proper transportation to get to their healthcare appointments the way that they should. And then once they get to those health appointments, not having medical professionals who help you. We had a woman die yesterday or the day before. She's a 4-week-old, and we worked with her. She was living in a house that had black mold. And this was the second or third African family that moved into this house. And they were trying to clean it up, but they weren't going to pay for them to move somewhere else while they were supposed to clean it up. And so she lived there for I don't know how long, more than a year, I think. And the doula that we had assigned to her was advocating for her as best she could, was interpreting for her. They were, where they were living, they didn't have access to a lot of fresh food. So she ended up dying later. They found out she had undiagnosed stomach cancer. So this husband, who has 7 other children and a 4-week-old, her outcomes were definitely impacted by those social determinants, like the housing, her access to food, her access to proper health care, advocacy in her language. So all of those things helped determine her outcome, which was death.
Thank you, Bahia. I do want to acknowledge that Mike, who had the question earlier that you did and a good explanation of, he wrote back and said, good answer. So thank you for that, Mike. I do appreciate that. And I do have another question, or a comment mostly. It said that Alex was telling us that deaf people experience a lack of interpreters in healthcare settings, often, especially right now, with the lack of personal PPE. So personal protective equipment in a healthcare setting. So I do understand that some of that has to do with all the masks that everyone's wearing, and that gets in the way of people understanding and communicating well. Yeah. I didn't see a question in that, but I did see the comment.
Yeah. I've been thinking a lot more about access, improving access for folks with disabilities and everything that we're doing.
Okay,
Seeing that
sounds good.
Compounding.
Okay. Yeah, we have had several comments on here about people that are excited about looking for this information, other people who would like to share it. We will tell you that we know that some of you experienced some difficulty being able to get on site with us today because it said that the meeting was booked full. So we have actually expanded our options and we're able to open up to as a maximum of 500. The latest I saw that we had 161 screens today. And I know that out there, some of you are watching in groups. I know people who are watching in groups. So it's been wonderful to have so many with us. I'm just wondering if there's any other questions as we wind down our time together. There was a question on here that came up and it seems very pertinent. So it says, it was from Jennifer, and it said, I saw a Facebook comment from a casual high school friend who had a negative comment about taking a knee during the national anthem. How would you have handled it?
Okay, am I glitching? Something happened, like, maybe I'm not. So, well, two things. One, I think that, you know, in terms of handling the negative comment, I think that when people make negative comments, they definitely don't want to be ashamed publicly. So I would write them privately in a private comment and say, can you give me an example of when someone from a community that's been oppressed has taken a stand in any way that society has said was okay? In any instance that they say silently, kneeling, not whatever, have you ever seen this instance where it was actually okay? And so what would be the alternative to making a protest when you have a platform to make a protest? What do you think could have been done that you would be okay with? And usually people don't have an answer because there's never been any way of protesting that anyone accepts. So it's violent or it's not violent, it's loud or it's too quiet. So if they can't give you those examples, just ask them, you know, I'm curious as to what part of that is offending you, right? Because if the part of it that's offending you is that it's because it's the national anthem, it's a song, we also have to recognize that in that same song, there's a whole stanza about finding slaves and killing them that they don't even use. So I don't feel like we should have to listen to it at all. But the idea that that, you know, what is the part of it that you're reacting to, and why? I'm curious why you're not reacting to this person's frustration to the killing of unarmed people. Why? I'm curious why that isn't the thing that you're feeling the most upset about. Like, you're upset about this, you understand, like, why? So I would ask them to be curious about how, if it was a little girls being killed, or, you know, anyone in our Oregon, I would say animals, killing animals would get you a certain level of emotional response from, I think, a lot of Oregonians, because they can feel their way there, but they can't always feel their way towards African Americans. So.
Okay, thank you. And then I have a request that I spell out loud. The last name for Joy, Dr. DeGruy. It's capital D-E, capital G-R-U-Y. So when you're looking up websites, you get the spelling. Again, it's capital D-E, capital G-R-U-Y. Great. I think that covers all of the things I'm seeing on the chat at this time. So thank you everyone for coming, and we'll look forward. We do this every month. So we are confirming a talk for next month, and as soon as we have the details, we will make sure that we get that out to everyone in advance.
I did see someone who was looking for suggested readings.
Oh, okay.
A lot of good books out there right now. I think my friend Ruha Benjamin wrote Race After Technology, which is great. Talks about algorithms and racism and how that kind of creates that implicit bias is actually helping people be racist a little bit more efficiently in systems. So just paying attention to that. And of course, post-traumatic slave syndrome, which my mother wrote, which is amazing. It talks about trauma in the African American community. The New Jim Crow is a really great one, talking about the history of the law enforcement and the legal system in the United States. Let's see what else. Oh, My Grandmother's Hands is a really good book, which is really about the physical manifestation of racism in your body. That's a really good one I read recently. Oh, and Mitch Jackson is a friend of mine, and he wrote The Residue Years, and he also wrote Survival Math, about growing up in Portland. So that's an interesting take on a local experience. So that's all I can think of right now. But
Great. Well, Bahia, you might mention you have some talks that you've been doing online.
yeah.
I think on the Dr. DeGrew website.
Facebook page and YouTube, yeah. Facebook.com/Joy DeGrew Publications, or the YouTube channel, YouTube/Joy DeGrew. We've been doing Wellness Wednesdays. We started doing that to support people during COVID, mental health, but it kind of is developed into a platform for us to talk about issues that impact Black community, and it's been a source of health and healing for folks. So if you want to check those out, yeah, the recordings of them are on there. Yeah.
Great.
Thank
and
you
again,
all.
I really encourage you to look up the Facebook page for Take Part. A lot of people are posting things to that. Hopefully we'll get more and more suggestions on there for people who are seeking resources. And I'm seeing some thank yous for Bahia. I don't see any other questions on the chat. So Bahia, I want to personally thank you on behalf of everyone. And there are a couple of things that are just, a lot of things are popping up to say thank you. We'll work on getting the video posted. And thank you so much for all of your time today.
Thank you again for having me.
Thank you.
Thank
Bye.
you. All right, bye-bye.